So what we have done is that we have looked at the impact of FLT3 inhibitor prophylaxis in the patient received allogeneic stem cell transplant. After the allo transplant, you'd like to see whether it's beneficial or not. So we have collected 439 patients' data, across the world, and what we have found is that definitely FLT3 inhibitor is beneficial to prevent the relapse. Also, at the same time, out of that patient, it looked like if they have a FLT3-ITD, NPM1, and DNMT3A, their outcome is way worse, even after the allo transplant. That's number one finding that we found. And number two is that, however, even they have a FLT3-ITD, NPM1, and DNMT3A, which is kind of worse triple mutation. However, whenever they get a FLT3 inhibitor maintenance treatment, their outcome is going to be mitigated. So they will have a similar kind of outcome in comparison to the other group. Those have a favorable outcome. So the FLT3 inhibitor will be helpful to improve their outcome, even the patient having a FLT3-ITD, DNMT3A, and NPM1 mutation. That is our message in our study.